Hello everyone and welcome. It's great to be sitting here with Bret Jorgensen, Chairman and CEO of just kind of the next generation healthcare company, MDVIP. A company that 15 years ago saw a big opportunity in personalized healthcare, and today is a leader in that field. And not that that's enough responsibility, Bret's also Chairman of Crossover Health, which supports larger self-insured employers, and hopefully we touch on that in a minute. So thanks for stopping by.
Yeah, thanks for having me.
We're obviously at an interesting crossroads in medicine, right? We know what's happening legislatively, and that's another can of worms, but we also see some amazing things happening in the private sector, like what you guys are doing. As a leader in one of those companies, what are you most excited about?
Well, I think one of the biggest changes going on today in healthcare, and we're kind of just at the tip of it, is I think we're at the start of a big era of consumer engagement. So we have historically had consumers be really unengaged, disengaged in their health, other than when they got sick. So something happened, they had an illness or an injury, and then they would engage. And that was true across every level of healthcare. So how they bought healthcare, how they got insured through their employer or through the government. And what it's led to is a system that has not only a lack of consumer engagement, but because of that lack of consumer engagement, there's an absolute lack of transparency on anything really meaningful from a consumer perspective, around cost, around quality, around what you're getting for anything that you engage with. And I think it's finally tipping the other direction, though fairly slowly. And I think the areas it's changing is you see big movements now towards high deductible health plans, more engaged, consumer engaged health plans. You see employers shifting more and more of the cost to employers, either through high deductible plans or at least having the employers absorb a bigger chunk of that. And then you see, because of those things, other movements around technology and stuff like that is starting to get consumers much more engaged in their health as well. So I think that whole movement around consumer engagement in healthcare, which is obvious for most industries, but been completely lacking in healthcare. And I think that's really an exciting thing for the system.
What's it going to take to make that shift? What's it going to take for most of the people watching and most of society to understand that engagement is really the catalyst to wellness?
You know, I don't know what it's going to take. I can tell you a couple things that have to occur in my view. One is I think you have to have consumers have awareness and engagement in the economics of it. So you can take something as simple as, you hurt yourself and you need to go get an MRI. You visit a doctor and they say, all right, go get an MRI on your knee or something. For decades now, consumers have not only, again, not purchased the insurance, they have no data on that. So what do? They say, okay, well, where do I go get that MRI? All right, and they recommend the one down the hall, the one across the street, whatever it is. May or may not be the best magnet to get that image. In one local market, like here in San Diego, that image could cost you $500 or it could cost you $2,000. Same need, same issue, right? And nobody has visibility on it. So to me, what I think it takes to get true consumer engagement is some degree of transparency on pricing. And I think the only way you really get that is if the employee or the person, the consumer, has skin in the game somehow. And again, it doesn't have to be their money. It could be in the form of an HSA with an employer contribution that if they don't spend, ultimately becomes their money. But it could be funded by somebody else. But at least if there's a pot of money around that forces them to think about what they need, I think that's probably the biggest tipping point. I also think that technology is going to be a very big tipping point in this. For most of us, I think with healthcare, because we've been insulated from a lot of the details around the purchase and the cost of things, people don't even ask questions about it, just like in the MRI example. But you would never go buy that Mac, without thinking about, well, what does it cost you? About how's it perform compared to something else? Do you need this amount of memory or that amount of memory? You don't have to understand all the inner workings to know, what's the value proposition here? What are you getting for what you pay, And price is just one thing. Value is price is what you pay, value is what you get, right? And in healthcare, both of those are gone, right? They're just not out there. And so I think that people can understand it if, in fact, we're given the information. I think technology is one of those things that I think is going to cause people to engage. Like a lot of these mobile devices we were talking about, like the Apple Watch, great devices. Not right now. So much of the technology around healthcare so far has been more about activity level stuff, right. But that's completely changing.
Yeah.
I mean, there are smart Band-Aids now that are tracking biometric data.
I haven't heard of those.
Yeah, and you can clip an ECG onto your iPhone and monitor your heart. There are going to be so many wearables and other things, or wireless things to tools to glucometers, things like that manage diabetes. All of these things at some point are going to get refined enough for real clinical engagement. So far, it's been more, the big noise has been around activity, but that's going to change a lot. And I think consumers will, armed with the right information, will be able to make a lot smarter decisions, more timely decisions, things like that.
Well, that's where MDVIP comes in, because I shared with Bret a little earlier how I was an advocate for concierge personalized healthcare literally 20 years ago, and I didn't know anything about it other than you have a personalized physician, your medical records are in one place all the time. I travel anywhere around the world, I know where to call. Just the convenience factor was huge. But you guys have been doing this for 15 years, so tell us the story behind MDVIP.
Sure. Well, for your audience, MDVIP is a national player. We're the largest player in the personalized care space. People tend to think of this as concierge medicine. We tend to view it as personalized preventive care, but the idea is to have a more personalized relationship with your physician, so you can more effectively manage your health, or whatever level that might be at. We have doctors in 42 states, 240,000 members, all paying and voting with their credit card. So when I talk about the absence of consumer data in healthcare, we're the exact opposite. They know exactly what they're getting, they know the value proposition, they know the doctor engagement, and if they don't like what they get, they don't stick, right? And they're paying and voting with their credit card every single year. Now, I would tell you, we do have a 94, 95% member satisfaction level and a 90+% retention level of those members.
That's phenomenal.
And they do, and these are for what arguably are incremental healthcare costs. Now, I know there are incremental healthcare costs to the consumer that end up saving an awful lot of money to the system, but the basic model and approach is we convert a busier primary care practice, typically internist, into a smaller practice that's more personalized care approach. And the cornerstone of the program is an annual wellness exam, so that all of our members have a baseline on their health, and then importantly, they have a physician coach to help support them throughout the year of whatever they're trying to accomplish. So for a young, healthy guy like you, it might be trying to stay young and healthy. For somebody who's 75 years old and already has a couple of chronic illnesses, it may just be managing that chronic illness more effectively. And I would tell you that the model works. I mean, we have 80+% reductions in hospitalizations and ER visits. We have 90% reductions in readmission rates. And as I noted a moment ago, we have high levels of satisfaction and retention in our members. So, so the model certainly does work. I think it is a terrific approach to care, because I think our members end up having, basically an advocate. So whether they do end up in a hospital or they're just trying to be active or, be a little more fit or anything else, they have a health coach through that process. So MDVIP started 15 years ago. We've grown steadily. We now, June 30th, finished our 58th consecutive quarter of doctor-patient revenue and gross profit growth. That's a pretty unusual string of
in that world.
In the healthcare world, that's unusual. And again, it's a regular growth story that really stems from solving a series of problems. We help doctors engage in a personalized care model that they like, that they feel they can have a bigger impact on patients, and our members get a healthcare approach that's just more manageable for them as well. And it's intentionally priced at a point that I believe gets kind of the middle market and sure some of the upper market, but it is not a wealth care model. It's typically, $1,500 to $2,000. It's the cost of a cable bill or
or less than 10% of what a family typically pays for healthcare.
Yeah, and one point to make sure that everybody is clear on is obviously our members also have insurance. So we have a lot of Medicare members, for example. We have 110,000 or so Medicare members. So they either have commercial insurance or they have Medicare insurance to cover things like hospitalizations and procedures. So MDVIP is not an insurance program. It's just a program that allows them to get a more personalized care model. And the system in and of itself, I think, it works, as I mentioned, the avoided hospitalizations and ER visits and readmissions. So we did a study just on the avoided hospitalizations that showed that Medicare could actually pay the membership fee for our member and get almost a 200% return on their investment a year in just avoided costs, right? So now there's a little bit of a misalignment in that, right? It's the consumer spending the money,
exactly.
And it's the government saving the money in this instance, but nonetheless, it works. And the consumer saves money as well, because if you're not in the hospital, you don't have complications, you don't have added issues, you don't have co-pays, you don't have all the stuff that ends up costing the consumer money as well.
So I was going to ask you that. I guess that's the misconception, I think, about concierge, personalized healthcare, concierge medicine, is that it doesn't replace traditional insurance, it simply integrates with traditional insurance.
Absolutely, and it is compatible with, I think, pretty much any insurance. It is also HSA qualified and FSA qualified, so if somebody has a high deductible plan, it pairs nicely with that. So yeah, I think it is compatible, and I think it's certainly compatible with the goals of even the ACA. I mean, we're not affected one way or the other with Obamacare and the ACA, but the goals of that is to get people more engaged in their health, right? And to get some people who are uninsured insured. And if you can get people engaging with their health, that is your best chance at avoiding health costs. And that's exactly what we do. Our whole model is aimed at people getting engaged in their health.
Brett, what do you know now that you didn't 15 years ago?
Oh, hell, a lot of stuff. Across, as a leader, I know a lot of things, I suppose, that are different. In MDVIP, I think right now for us, the interesting thing for us has been trying to figure out how to message and get consumers engaged. Despite all of the challenges in the healthcare system, it is still hard to get people engaged in their health.
Sure.
And it is an incremental spend, and I always respect that, because anything that costs more money, it's always a challenge. But we do believe that there's a terrific value proposition, but the hardest thing for us is to get people to be aware of it, because maybe, I think there is an increasing awareness of this kind of an option out there. But given how our practices are typically made up of kind of middle class, upper middle class kind of people, and we've got the whole gamut on income levels out there, a lot of consumers aren't searching for this until, somehow we can connect it to them. So that often that is when we convert a practice and we get an opportunity to engage with a consumer about this approach to care, and then some of them buy. But I think that's probably, at least, I'm not sure I've learned to solve the problem. We're getting a little bit better about it and smarter about how we engage consumers, both in the practices that we're trying to convert, but then also what we call community joiners, just people who learn about the model or the approach and join our practice. We have a few thousand of those joining on any given month, so there's a lot of people that learn about us through blogs, through SEO work we do, through any number of things to try to create awareness. But I think that's probably the biggest biggest thing that we've made progress, but I would tell you I still don't know as much as I need to know about it.
Well, you know enough. But I think that the best way to experience it is to actually live through it, right? I've seen, I've experienced, and I've heard you reference. You go to a doctor, and your average time with that doctor is probably 6 to 8 minutes, right? You go to one of your doctors, the average time is probably 30 minutes. The focus is not on sickness. Your doctor's focused on wellness. It's focused more on integrated medicine. Is that the secret?
Yeah, absolutely. I mean, honestly, I think a lot of the outstanding results that our doctors accomplish are because we've removed the clutter. The model removes the clutter, and the clutter is often between the patient and the doctor, right? And whether that's in the form of wait times or short visits or pre-authorizations or any number of things that could get in the middle of that, this kind of eliminates that, right? So again, as I mentioned, the cornerstone is this wellness exam. So if you take a doctor who has, instead of say 2,500 patients, has 300 to 600 patients, he or she will know those patients better. The whole point of the annual wellness exam is to know them better. And so even when it comes to things like that we talked about, our structure, the way we came about capping the model at 600 patients was kind of straightforward math. We said, okay, we know we want to do annual wellness exams. We want that baseline health. We want enough time for coaching. We want enough time in their calendar for same-day appointments. We want appointments to be 30 minutes and unhurried so you can get to the real issue and not just simply triage. And you kind of work backwards from that. You go, well, you can't actually have more than 600 patients. And then obviously the older they are and the sicker they are, you can't even have 600, right? Depending on what the panel looks like. And because of that, you end up having patients when they just can come in, see the doctor, have the issue resolved. It makes such a difference in cost. So I mentioned this 80% reduction in hospitalizations in ER. Well, if you were to look in the typical doctor's office and grab a business card out of a doctor, and I don't say this to disparage doctors, I love doctors because we work with them all the time, you won't find a cell phone or an email on those.
Right, yeah, absolutely not.
And the reason is that's just not how they get paid, and they can't really engage with you as a patient, as a consumer that way. And that's not a knock on doctors. It's just the structure of the system, and they have to survive and thrive in that. Unfortunately for the doctors, especially primary care doctors, the only way they can create a viable practice in today's environment is to keep piling on patients. Mm-hmm. Their reimbursement's not expanding, so you keep piling on patients. The experience for the patient gets worse and worse, right? So now you take a patient after hours who's having a chest pain or a problem. In today's environment, normally what they would do is they call the doctor's office after hours. They're going to get a recording, and the recording will say something along the lines, if this is an emergency, go to the hospital, right? And people do. By contrast, our member has the doctor's cell phone number. They have his email address. They can engage with the doctor immediately, whether it's an emergency or not, right? And so the doctor, if they call the doctor, they're likely to get the doctor. Or get a return call quickly from the doctor. When the doctor gets on the phone with them, which in and of itself is the first step in avoiding costs. Yeah. Then, importantly, that doctor knows the patient. They know their history. They know the drugs they're on. They know everything about that patient and can intelligently say, don't go to the ER, I'll come see you. Or don't go to the ER, I've got a time slot in the morning for you. Come by and see me. I'll make room for you. Or I've got whatever time window. That by itself avoids so much cost in the system simply because they can engage with the consumer.
And it also has a tremendous amount of reassurance.
Absolutely.
When I know that I'm going to call Bret, regardless of what happens, I'm going to call you, or I'm going to text you, or I'm going to email you, and I'm not going to get the same message that I'm getting.
Absolutely. And we have so many, if you ever get an opportunity or any of your listeners get an opportunity to look at MDVIP's website, mdvip.com, there's so many testimonials on that website of unsolicited testimonials, photos, and they run across a couple of threads. One is either how the doctor saved their life, or made such a big impact in some situation that they had of managing some illness or a family member's illness. And the other is how this model of health and engagement is allowing them to lead more vibrant and healthy lives than they've ever led before. So we actually have, if you were in our corporate office ever, all around our office walls are pictures sent in voluntarily by our members engaging in life. And so it's whether they're skiing, whether they're fishing with a grandson, whether they're doing a triathlon, it doesn't really matter. They're doing something to be more active and engaged in life. So almost all those testimonials are about how just that incremental focus on health allows you to live a more vibrant life, or avoids an awful lot of complexity if you're sick.
And that prolongs life.
Absolutely.
Right? Living a vibrant life prolongs life. All right, a couple more questions for you. So walk me through the process. I get on the website, mdvip.com. I say that I want to join. Again, we're talking very incremental costs. We're talking an average of $150 a month.
Yes.
Right? Take me through the process from there once I make a commitment that I want to join.
So, as I mentioned, we're in 42 states, so we're in not every market, but most markets. And you can go onto the website. You can, if you know a doctor, because maybe somebody had mentioned a doctor, you can just type in the name. Every one of our doctors have microsites with backgrounds, their clinical philosophy, patient testimonials.
It's fabulous.
All of that stuff is click of a button away. Or maybe you don't know any doctor, you just are interested in the model. You can just search by zip, and it'll tell you every doctor within whatever range you're looking for, a few miles, 20 miles, whatever. And then based on that, it'll tell you, again, you can drill down and look at any doctor's practice, what their philosophy of care is, all of that kind of stuff. And then you can set up a meet and greet. There's a quick click to it, no cost, no obligation. You can actually, all of our doctors are used to this, that somebody says, hey, if I'm going to go pay for a personalized physician relationship, I'd like to get to know the physician a little bit. Very common. In fact, if somebody asks me as a friend, hey, Bret, who should I go see? I'll set them up, and I'll always make an introduction and suggest a meet and greet. And they'll go in, spend a little bit of time with the doctor, half an hour, whatever they want to do. Very rare in and of itself, just to be able to go do that. Talk about whatever health issues they might have on their mind, and can make a decision. And then once they join that practice, and by the way, they can do that with multiple practices. They can look at several doctors. We have a lot of markets where there are many options nearby a consumer. They can pick a doctor that they're interested in, and then once they do that, our members typically pay either a fee up front when they become a member, or they pay it quarterly. Again, there's pay online. There's very straightforward process for that stuff, very easy and engaged. Even automatic charges, just straight from checking account if you don't want credit card charges. All of that's very straightforward. And then once you're involved with the doctor and they meet and understand sort of what your health objectives are, sometime typically within a month or two, they establish that annual wellness exam, which is really that comprehensive baseline we talked about. And from there, you're off and running. And there are a couple of benefits that I think also worth noting. If whether you're somebody living a leisure life and you're traveling, or you're somebody who's a busy person traveling for work, we offer reciprocity to our members. So that if you live in San Diego but you go to DC and you're sick, or you need to see a doctor or talk to a doctor, we coordinate that care through MDVIP. So this reciprocity program. We also, for our members, allow non-pediatric age children to see these doctors. So 13 to 26 age group to see the doctors for free. I've taken advantage of that many times. My son is seeing my MDVIP doctor next week for his pre-dive certification physical that he has to get. So, which is a terrific service for us as well.
I think that's fabulous. I want to ask two more questions about MDVIP and just one more personal question about you. But if you were, a lot of listeners are great entrepreneurs, founders of companies who are doing great work. They're working really hard to create cultures of wellness, right? I think that's one of the mantras of this generation. What advice would you give a company that maybe has 10, 20, that someday very soon is going to go to 100 employees to create that culture with relationships such as yours?
Well, I think there are a couple things you can do, and there are things that I try to do myself as well. I mean, I mentioned our members living happier, more vibrant lives. I very much try to subscribe to that myself. So I like to drink the Kool-Aid as well. So I'm an active person. I try to engage in my health and by being athletic and whatever level that is, right? I try to encourage employees and encourage the company to behave that way. So we get involved in activities. We have, for example, at MDVIP, a regular lunchtime walk that different members of the management team just encourage people to get out and walk, right, on a lunch break, right? It's a simple thing. But I think there are bigger things that you can do as an employer too. We offered all of our employees, after 6 months of working for us, to get an MDVIP membership for free. And so we try to have them drink the Kool-Aid as well, to engage in that model of care so they understand it. Now, I know not every employer can do that, right? So they can't give an MDVIP membership, but they can do things about how they think about and design benefits to encourage people to get engaged in their health. So those can be, like I said, activity things, but it also could be encouraging high deductible plans. So even if it's a smaller company that can't be self-insured or something like that, you can still do high deductible plans that create engagement with consumers around their health, that rewards people for doing things like taking health risk assessments, or rewards that you could, for example, contribute a certain amount of money to an HSA for taking a health risk assessment. If that health risk assessment indicates something that needs to be more proactively managed, let's say pre-diabetes or something, and you engage in a program there, you can deposit more money in that as an employer. That's going to pay off down the road for you as an employer, and it's going to get the employee engaged in managing their health because you're removing economic barriers. And I think that is a much smarter way to go about it than the traditional way, which is just have a big insurance plan with a very low deductible and people don't know anything.
But that's all we knew for a long time.
Exactly.
That's all we knew for a long time.
And you can't blame an employee because basically you go in and you get one health plan, and it might be an HMO option or a PPO option, and that was it. Well, that's changed a lot. Even high deductible plans by itself. I mean, I don't know, 5, 6 years ago, less than 10% of the companies offered them. Today, it's over 80%. 5 years ago, 4 or 5% of employees were on them. Now, it's 5 times that. Still the minority, but it's the most rapidly growing segment. So I do think there are things you can do both culturally and then even in benefit design and your philosophy around employee benefits that can encourage people to engage.
And Bret, for the millions who still don't have health care because they can't afford it for whatever reason, this is a step forward.
Well, if somebody can't afford health care, they're not likely to spend money on an MDVIP model. Because it's
if I can't afford $1,000 for my family, but I can afford $150 a month just to get a wellness exam and to know at least that I'm in the right direction, that's a heck of a lot safer for my family than not having it.
Yeah, and I think right now, obviously, there's a lot of the ACA is around getting people who haven't been insured to be insured. I frankly think whether it's MDVIP kind of an approach or any other way you get engaged, I as a healthcare leader, I certainly think it makes sense for everybody to be engaged in their health on some level. And I know that may be a very skinny down plan, subsidized through the ACA. That's fine. But everybody needs at least catastrophic care. And I think everybody should do things that allow them to at least be aware of what their health baseline is, because it's the only way you can manage it.
You've been doing this for a long time. My last question is, how do you feel as a leader you've evolved?
Well, like everything, I've certainly, I've gotten older and more mature, more gray hair.
It looks good on you, though.
Well, thank
right?
you.
It matches the physique.
That's right. I try to tell my daughter it's still blonde, but she doesn't let me get away with that. So I think I've evolved in a lot of ways. I mean, I've always been a pretty delegative leader, and I think I'm even more so today. And to me, one of the big cornerstones, and I wouldn't say this is necessarily, it's not new to me as I've evolved as a leader, but it's a very important part of my leadership, is a focus on culture. You know, so I've always, and today I do it even more so probably than ever, but you know, focusing on fostering the right kind of an environment and a culture. And MDVIP has a terrific culture, and for me, the kinds of things I like to foster are things that get the organization to be action oriented, have a bias towards pace and passion and accountability and things like that. So we actually have a couple things in our company around core values, and I think it's important for anybody trying to build a business. A lot of times people think, oh, you can't really engineer a culture, and I actually just think that's flatly wrong. You can engineer a culture, and in fact, if you don't, you're going to get one, and it may not be the one you want. Right? And so, for us at MDVIP, we have a set of core values that are represented by this acronym IIPLT, which stands for integrity, innovation, passion, leadership, and trust, and they're all cornerstones of sort of how we try to go about what we do. But there's another element about what we do, which is, hey, our job and our life is about bringing together a model with patients and doctors that creates that sort of healthier, more vibrant life. So the IIPLT is in that order because it also stands for two other important elements of our culture. One is about helping facilitate that, so it stands for I improve people's lives today. And the other element of that culture is about I'm doing something. It's about accountability to make that happen. So I would say as a leader, I understood this earlier on. I think I understand it better and more deeply now, how just fundamentally important it is to have a clearly articulated culture and a vision of what that looks like. And then you have to be the passionate keeper of that. As a CEO, I think you have to be the one who makes that live and thrive.
And that's something that evolves together, right? This is not something that Bret just one day sat down and wrote down, hey,
Absolutely.
Here, these are 5 cool words we're going to use. No, that's something that has evolved with your team.
It's very authentic, and in fact, it's a very important point, right? Because when we did that, it was exactly that kind of an exercise with our employees, to have them pick words and adjectives that describe who we are and how we behave and how we think about things. And it took a fair amount of massaging direct feedback from them to distill it into the words that we felt most represented us. And then it was, okay, well, what's still missing? Well, this idea, if you just looked at the words, what was still missing to us was this notion of true accountability and this notion of helping people. And that took some added work to kind of go around, but I had a very specific idea which said, okay, now that we know the sort of the behaviors that we think are who we are, how can I come up with a mnemonic device that hopefully captures those other cultural elements and helps people to remember IIPLT, right? So that part was deliberate, but it was a deliberate working around the idea of trying to connect some of that feedback we got from employees to real named kind of values in the company and come up with a mnemonic device to help make it all memorable.
Well, that's what great leaders do. Well, and when I had the opportunity to interview Bret, I couldn't be more excited because I can't think of a more important topic for us to share with the world than to help people take control of their healthcare. And I think the innovation that you guys are doing is just beginning. When you integrate what you're doing with all this great technology that you referenced, I can't wait for the next 15 years. So, one, thanks for stopping by. MDVIP is the website, mdvip.com. If nothing else, just explore it and see the difference between what you're experiencing in medicine and what these guys can provide.